What's up everyone, Chris Haria here. Whether you're a seasoned lifter or just starting to push your limits, today's topic is one every serious athlete needs to understand. We're diving into a crucial subject for advanced bodybuilders and anyone considering performance enhancers, post-cycle therapy, or PCT. This is something that separates the casual gym goer from the truly dedicated athlete. After weeks or even months of pushing your body to the absolute limit, training hard, eating with precision, and maybe even using performance-enhancing substances, your body needs a reset. PCT is the recovery phase that helps bring your system back to its natural balance, so you can keep making progress without sacrificing your health. Here's the science. When you use anabolic steroids, your body senses the extra hormones and stops making its own testosterone. This can throw your entire hormonal system out of whack. That's where PCT comes in. It's a carefully planned protocol designed to help restart your natural hormone production, so your body can recover and function normally again. Without proper PCT, you risk losing hard-earned muscle, feeling fatigued or depressed, and even causing long-term damage to your health. It's not just about feeling off for a few weeks. Skipping PCT can have lasting consequences. That's why PCT isn't just a suggestion. It's absolutely essential for anyone who's used these substances. It's the difference between a smart, responsible athlete and someone gambling with their future. PCT is about protecting your gains, your health, and your ability to keep training at your best. It's the insurance policy for all the hard work you've put in. Imagine spending months building muscle, only to watch it disappear because you skipped the recovery phase. That's a nightmare scenario for any athlete. PCT is your best defense against muscle loss, hormonal chaos, and the emotional roller coaster that can come with hormone imbalances. Taking PCT seriously shows you're committed to your long-term success and well-being. It's a sign of a smart, responsible athlete who cares about longevity and peak performance. In this guide, we'll break down why PCT matters, what it involves, how long it typically lasts, and the real risks of skipping it. We'll also cover some common myths and mistakes so you can avoid the pitfalls others have faced. This isn't just about following a trend, it's about making informed, safer decisions for your fitness journey and understanding the science behind your choices. Remember, knowledge is power. The more you know, the better you can protect your body and your progress. Whether you're new to this world or have years of experience, understanding PCT is non-negotiable if you want to stay at the top of your game. It's not just about looking good for a season, it's about staying healthy, strong, and motivated for years to come. So let's dive in, break down the facts, and make sure you're set up for long-term success in and out of the gym. Your body deserves the best care possible. Let's talk PCT. Ready? Let's get started. To really understand why PCT is so important, you first need to know what happens to your hormones when you use steroids. Steroids don't just make you stronger or help you build muscle, they fundamentally change the way your body's internal systems work, especially your hormones. At the center of this is your body's hormone system, known as the HPTA, the hypothalamic pituitary testicular axis. This system is responsible for controlling how much testosterone your body makes, and it's a delicate balance that your body works hard to maintain. When you inject anabolic steroids, you're introducing a large amount of synthetic testosterone into your system. This sudden surge tells your body that it already has more than enough testosterone. In response, your body tries to protect itself from having too much hormone. It does this by shutting down its own natural testosterone production, essentially putting your HPTA system on pause. While you're on a steroid cycle, this shutdown isn't a big issue because you're still getting testosterone from the steroids. Your muscles keep growing, your strength stays high, and you feel powerful. But the real problem starts when you stop taking steroids. Your body's natural testosterone production is still suppressed, and it doesn't just switch back on overnight. You're left in a hormonal void. Recovery takes time, sometimes weeks, sometimes months. Your body needs to recognize the lack of testosterone and slowly restart its own production. But this process is far from instant. During this gap, you're at your most vulnerable. Without enough testosterone, you can lose muscle mass, feel tired and depressed, and even experience issues like low libido or trouble sleeping. The side effects can be both physical and mental. The longer and heavier your steroid cycle, the more your natural hormone system is suppressed, and the harder it becomes for your body to bounce back to normal. If you don't take steps to help your body recover, your hormone system might never fully return to its natural state. This can lead to long-term health problems, including permanent hormonal imbalances. That's where PCT, or post-cycle therapy, comes in. PCT is a carefully planned process designed to kickstart your natural testosterone production and help your body recover as quickly and safely as possible. It's not just about waiting and hoping for the best. PCT is about actively supporting your body's recovery with the right medications, supplements, and strategies. Ignoring this process or skipping PCT can leave you dealing with long-term hormonal issues, which can affect your health, your mood, and your progress in the gym. Think of PCT as the bridge that helps you move from relying on synthetic hormones back to your body's natural balance and strength. Don't leave your recovery to chance. Understanding what's happening inside your body is the first step to making smart, healthy decisions. The right post-cycle protocol can make all the difference in how quickly and completely you recover. Take control of your recovery and keep your body running at its absolute best, both now and in the future. What happens if you finish your cycle and skip PCT? You're risking severe low testosterone, hypogonadism. This means fatigue, loss of libido, and even erectile dysfunction. Your hard-earned muscle is at risk too. Without enough testosterone, catabolic hormones like cortisol take over, breaking down muscle. That's why some guys lose all their gains after a cycle. They didn't recover properly. Hormonal imbalance can also cause gynecomastia, male breast tissue, due to lingering high estrogen. PCT drugs help block or lower estrogen, restoring balance. Mentally, low testosterone can trigger mood swings, depression, and anxiety. PCT helps stabilize your hormones and your mood. It's about full recovery, body and mind. Don't gamble with your health or your progress. PCT is your insurance for keeping gains and staying healthy. Let's break down the main medications commonly used in post-cycle therapy, or PCT, and why each one matters for your recovery. The most widely used are SERMs, selective estrogen receptor modulators, such as Clomid and Nolvadex. These medications are staples in most PCT protocols because of their effectiveness. SERMs work by blocking estrogen's effects at the pituitary gland, which tricks your body into thinking estrogen levels are low. This signals your brain to ramp up natural testosterone production, helping restore hormonal balance after a cycle. By kickstarting your natural hormone output, SERMs help you regain energy, motivation, and overall well-being, which can take a hit after a cycle. Aromatase inhibitors, or AIs, like Arimidex, are another class of drugs sometimes used in PCT. They actually lower estrogen levels in the body, but they're used more cautiously because dropping estrogen too low can cause its own set of problems. Overusing AIs can lead to joint pain, low libido, and even negative effects on cholesterol. That's why most PCT protocols focus primarily on SERMs, reserving AIs for specific cases where estrogen is especially high. For those coming off heavier or longer cycles, HCG, human chorionic gonadotropin, is sometimes used before starting SERMs. HCG mimics the body's own LH, directly stimulating the testes to produce testosterone and prevent shrinkage. Timing is crucial. HCG should be used before the main SERM phase and not overlap, to avoid interfering with your body's natural recovery process. Each medication plays a specific role in restoring your hormone balance, and using them correctly can make a big difference in how quickly and smoothly you recover. The right combination and timing of these drugs is crucial for effective recovery, minimizing side effects, and protecting your long-term health. Always make sure you understand what you're taking, follow your protocol carefully, and consult a healthcare professional if you have any doubts or questions. Timing your PCT is just as important as the drugs you use. Start too early or too late, and you risk poor recovery. For short ester steroids, begin PCT a few days after your last dose. For long ester steroids, wait about 2 weeks before starting. This ensures the synthetic hormones are out of your system. A typical PCT lasts 4 to 6 weeks. Start with higher doses of SERMs, then taper down. Adjust the length and dosage based on how suppressive your cycle was. Use a steroid half-life calculator to help with timing. Tailor your protocol to your specific needs. Precision here means better results and safer recovery. Where you get your PCT meds matters a lot. Many turn to the black market, but that's a huge risk. Studies show a large percentage of these products are fake, underdosed, or contaminated. You might think you're protecting yourself, but you could be taking sugar pills, or worse, harmful chemicals. Fake meds mean you're not actually doing PCT, leaving you exposed to all the risks. Some black market products contain undisclosed drugs, creating new health dangers. The only safe way is through a licensed pharmacy with a doctor's prescription. Don't risk your health for convenience. The consequences of fake meds can be severe and permanent. Protect your recovery by using legitimate sources. Your health is worth more than a shortcut. Many athletes look for safer ways to boost performance. Enter legal steroid alternatives. These are natural supplements designed to support muscle growth without shutting down your hormones. They work with your body, not against it, using ingredients like D-aspartic acid or tribulus. Because they don't suppress testosterone, you don't need PCT after using them. No hormonal crash, no complex recovery. This makes them a safer, simpler option for many. You can focus on training and nutrition, not on managing risky drug cycles. Legal alternatives avoid the health risks of steroids and PCT. It's about sustainable progress and long-term health. Build your body up, don't break it down. If you're considering steroids and PCT, do it under a doctor's supervision. Managing this alone, or with advice from forums, is reckless. A doctor will run blood tests before, during, and after your cycle. This gives you real data, not guesses, about your health. Pre-cycle blood work sets your baseline and checks if you're healthy enough. Follow-up tests show if your recovery is on track. Doctors can adjust your protocol based on your actual results. They can prescribe real pharmaceutical-grade meds, no black market risks. Professional guidance means safer, more effective recovery. Your long-term health is your most valuable asset. Protect it by seeking expert advice. Let's wrap up with some key tips for a successful PCT. Always have your PCT meds ready before you start your cycle. Don't scramble at the last minute. During PCT, adjust your training, lower the volume and focus on maintaining strength. Keep your nutrition solid. Don't cut calories too hard and keep protein high. Listen to your body. Fatigue and mood swings are normal as you recover. Prioritize sleep and stress management. Be patient. Recovery takes weeks, not days. Stick to your protocol and healthy habits. The goal is to restore your hormones, keep your muscle, and protect your health. Recovery is part of the process, not an afterthought. Take it seriously and plan ahead. Train hard, but train smart. Your health is your greatest asset. Protect it.